Hi everyone, welcome to a day in my life as a dentist practicing in Canada in Stoney Creek Village Dental. I usually get up at 6 and then I would go to the gym or go play tennis. And I come back home and get ready for my practice and leave for practice at 9:30. This practice is really close to my house and I'm there in just 5 minutes and no traffic. So this was up in Fort McMurray when I was there, and I am just driving to my office right now. Then it's raining, the weather is not good. You can see I can just go to my car park, which is underground, and 9:35 I'm in my office. And just greeting my lovely front desk staff, wishing them morning, finding out how things are going with them, and just chit chatting, going to the back, and greeting my assistants for the day. Today, Alex is going to be assisting me, greeting the patients, doing the room. She's doing most of the other things. And now it's time for me to change into my scrubs. Let me take you to a tour of the office. This is our waiting room, and I've already shown you the front desk. And that's our manager's room. She's off work today. She has a lot to deal with. And that is the room where all the staff puts their lunch, has their lunch. It's kind of a staff room. It's a space for staff. It's a small kitchenette, and there's the washroom, change room in there, and then there is laundry. So we don't carry our scrubs home. We do laundry there, and this is the fridge and everything. Let me take you to the back where all our operatories are, and let me walk in the direction. Before that, I want to show you that we have this pan machine with us. This is the pan room. These are different operatory setups in the most ergonomic designed manner. And the first stop here is the hygiene op, where usually the hygienist is working. This also is a hygiene op or an exam op. Then this op is for controlling the pan room for now. This is another hygiene op, so that 2 to 3 hygienists can work at the same time. This is the main treatment operatory, patient's washroom, and another treatment operatory number 2. And we have all our setup on mobile trolleys, so we can just roll them in the operating room if we need endo in one room, implant in one room. We can just use the trolleys to roll them in the operating rooms. And this is the back where we have our sterilization area, and my 2 assistants are preparing for the day. They are setting up the trays. They have a list of patients with them, and they are just preparing the trays. And this is the back area. This is some storage area for us. Let me just turn around, and there my assistant is preparing all the trays for the day. And it's time to go check my schedule. I'll just go check the computer. Don't steal my password, okay? That my son suggested I should write it there. So the day looks like today. The green colors are my appointments. The yellow are Dr. Milky's appointments, who's working with me. I'm just going through what's planned for the day, which patient what needs what kind of treatment. So when the patient comes in, I just meet them, and then Alex takes the required recommended IOP if they're coming in complaining of pain. It's an exam. Accordingly, we go. And here I'm greeting my patient, and yeah, I am behaving weird because that was my wife. And that's my next patient, and he needs a filling to be replaced. So we are working four-handed. It makes life way easier when somebody trained is working with you and assisting. I'm just going through the filling now. And that's done there. And in between the patient, Alex will clean the room, wipe down everything, make it nice and clean, and put things in sterilizer. And then it's time to treat another patient in the next stop, which was ready for that patient. And she needed some fillings. We're just doing some filling. She was pretty worried, has had a lot of anxiety, but we were good. We were able to take care of her, and she did pretty good. And in the meantime, when Alex is preparing for another patient, Ria, the hygienist, called me into the hygiene op to do exam for a patient who's come for a recall. So a recall is where the patient has come in for the cleaning, and the dentist is supposed to check everything, all the tissues or all tissues, radiographs, and find out if everything is looks good. This patient had an implant 3 months back and had some questions and were a little worried about the next phase. So I'm just discussing that part with her. My next patient who needed an endo, the plan was to do an endo in 1/7, but it turned out that he didn't want to go ahead with the endo, but the 1/8 was bothering him more, and today he wanted to deal with the 1/8. So we changed the treatment plan for this patient, and instead of going for the endo, we went for the extraction of 1/8 for him. Yeah, the day doesn't go as you plan, things change, you have to adapt. And there Alex is giving instructions, and she just took the consent for extraction. I would usually do the left extraction standing up. And that's my next patient who's come in for a denture adjustment. We delivered an immediate denture for the lower anteriors. He wanted some adjustments with them, and he was a little worried. More of, you know, helping the patient out in the thoughts. He was worried that this might hurt his teeth, but I told him there's nothing like that happening. And then the next patient just needed another aligner tray adjustment. The tray was pinching on her gums in the edentulous space, so I just adjusted that for her. And I'm done for the day, and I'll just go back to the computer, check all my notes, just make sure everything is in there, nothing has been missed, what was done, what was talked to the patient, and then I'll check all the billings, all the insurance claims, everything is in order. If there's anything off, I'll let the front desk know, I'll let the manager know, or if I cannot make any corrections, then that's time to go home. Bye bye. But it's not a bye. So a lot of people are missing from this video, especially my team. This is my whole team, my manager, my assistant, and this is my amazing boss, Dr. Alan Chan, and my amazing patients. So although it looks an easy effort, but it's all the team behind the scene. And thank you for watching the video. Please subscribe.